Hi, I'm Dr. Michael Craig with Dr. Spine in Bangalore, India. Listen, I want to thank you for your support at our clinic in Indranagar. The support from the community has been tremendous. We've helped a lot of people. And I'm now in Whitefield, beautiful downtown Whitefield, with actually bigger windows. I like it. It's a bigger clinic. We get more done here. We have other doctors. And so I would love for you to come visit us here in Whitefield. Today I want to go over something that a lot of my patients ask me about, and that is, doctor, I have this pain. I'm sitting all day long. I've got an IT job or I've got a desk job, and I'm working all day, but then I get up to move around, I walk, and there's pain down my leg, the back of my leg, and I've got this low back pain. I want to talk a little bit about low back pain with sciatica, which is what they're describing, and how it comes about, and one of the main things that you can do to help yourself to decrease that amount of pain, and also what chiropractic can do to help you get rid of that problem, or at least make that problem as small as possible. We've got a spine, and obviously this is the head and this would be the pelvis, okay? Now with the spine you've got several parts. As you can see, all of these are joints, and each of these joints have nerve roots coming out from them, and these nerves go everywhere. They go all over the body, and you've got nerve roots going in from the low back. You've got the nerve roots going through the pelvis down the back of the leg. We're going to focus particularly on the low back today, little bit how that works. Okay, now you'll notice beneath the low back, or what we call the lumbar spine, you've got two parts. You've got the sacrum, which is this triangular part here, and you've got the pelvis, or what they're called the ilia, which are right here. This is like your foundation. If you have a house and your foundation is leaning, you're going to have a problem, because your walls are going to lean, your roof is going to slant, and your shingles are going to fall off. So the foundation affects the whole spine. So how do you take care of your foundation? And in particular, low back pain. You want to get rid of low back pain? Listen carefully. What's going to happen is that there's a certain shifting of the pelvis that goes on, which affects the low back. There's only two ways the low back can shift, or the pelvis. It can either shift this way, or it can shift this way. Now I've seen both happen, but I'm here to tell you most of the shifting that takes place is one direction. And let me point out exactly what I'm talking about. Now when I get someone with low back pain and sciatica, first thing I ask them to do, I do an examination, but after that I ask them to go get some x-rays. Just two views from the back and from the side. And so this allows me to see the curvature of the low back. It also allows me to see the tilting of the spine. Okay? Now I'm going to show you an example. This is an x-ray of a young lady. She's in her mid-20s, and this is a picture of the pelvis. This is a two-dimensional x-ray, obviously, and so we're looking at the low back. The low back looks fairly straight. Now this young lady had some low back pain and some numbness in her leg. Okay, now when you look at the side of the vertebra here, the low back, you can see that the sacrum is right there. Hopefully you can see that. It's a little dim, but then the low back has a gradual curve like that. Now her curve is a little bit more than gradual. It's a little bit extra there. So, and she's got some tilting in the pelvis. And the reason I know that is because when you look at the pelvis as a two-dimensional picture, you don't see a whole lot. Even as a chiropractor in the beginning, I didn't see a whole lot. I would look at the pelvis and I would say, well, that's nice. I don't see any tumors. I don't see any fractures. I don't see any problems. And most medical doctors look at x-rays that way. As a chiropractor, however, I'm looking at the biodynamics. I'm looking at, or the biomechanics. How does the body hold itself? What's the posture? And how does the posture contribute to low back pain? So the first thing I notice is that this pelvis is tilted. Now, right here, you'll notice that there are two holes at the bottom. These are called ischial foramen. And these holes are fairly round. If you look straight at them like that, they look fairly round. If you look at the x-ray, they're almost flat. So that flattening of the foramen means something. And also this opening here of the pelvic floor is much larger than the opening right here as you're looking at a normal spine from the rear. And of course we're looking at the rear because this is the right side, that's the left side. This would be the right side of the pelvis. So if I'm looking at the pelvis and I'm looking at the pelvic floor, first thing I notice is that this is much narrower and this is much more round than the one on the x-ray. So how do I get a three-dimensional image to appear exactly like that? And what I do notice is that, and this is what I explain to my patients, if you're sitting like this, or if you're standing like this, and your pelvis tilts like that, you're going to see two things. First of all, you're going to see this opening here on the pelvic floor getting much larger. So that much larger opening of the pelvic floor means that the pelvis, both pelvis segments, the ilia, are shifting forward. Now also you'll notice the opening, the ischial foramen, they're much more flat, just like they are in the x-ray. So that's the clue that I have. When I look at an x-ray, immediately I can tell which way the pelvis has shifted. And I try to explain to my patients exactly how that happens and what they can do to correct that and make it better so that the pain doesn't return. Now when the pelvis tilts, obviously it's connected to the sacrum, this part here, and so when that also tilts, you've got this part called the sacroiliac joint, and so when the pelvis tilts, the sacrum has to lift up, just like you're lifting up what do you call it? In England they call it the boot, in America we call it the trunk. Either way, you're lifting up the back of the trunk or the boot and you're getting inside. So the sacrum will be sort of like that. And so when you're lifting that up, that's going to be tilted. And as you can see, the angle here, first of all, this way, and then it's this way. So that angle is fairly sharp. So when we tilt the pelvis forward like that, the sacrum tilts up. So my job as a chiropractor is to bring both the sacrum and the ilia back to balance. The whole pelvis needs to come back into balance. So I would be adjusting the sacrum this direction, also be adjusting the pelvis. I would be contacting these parts and I would be rotating it that way. So when we bring it back that way, then this area should open up, this should get a little more narrow, and you're going to get a balanced pelvis. And that's how chiropractors do it. That's one of my main jobs as a chiropractor, and that contributes directly to low back pain, because with this particular angle, you're putting a lot of stress in this joint right here called the lumbosacral joint. Lumbo means lumbar, sacral means sacrum. And this lumbosacral joint right here, it's like you've got a rubber ball in the middle or a cushion. And when you press on that cushion or squeeze that cushion, part of it's going to bulge out. And when it bulges out, it's going to have an effect on those nerve roots that come out there, and you're going to feel pain. It's going to go down into your buttocks, into your legs, in the back of your legs, and you're going to have sciatic pain. So first thing I do is I notice which way the pelvis is shifted. I adjust the pelvis, bring the sacrum back, take pressure off the lumbosacral joint, which also in turn takes pressure off the nerve root, which then allows the sciatic nerve to flow freely and to work perfectly, and that will take also the pressure off the muscles in the low back, and you're going to feel a lot better. Now there are things you can do to, once you get your pelvis balanced out, to keep the low back pain from happening again. And one of those is that you have, and this is what I tell my patients, you have a small book or you have something like a notepad or something. It only has to be about this thick, maybe a little thicker. And what I tell people to do is sit on that, just the last third of the buttocks when you're sitting down. What this does is it helps to push the ischial tuberosities back a little bit. It helps to rotate the spine just a little bit, rotate the pelvis rather, just a little bit to give you some relief. So that's one thing you can even start doing at home if you're not doing it already, is just start sitting with some support like that. Now obviously if you have low back pain a lot when you're sitting, I also recommend a lumbar belt, and you can also have a lumbar cushion in your chair if you're sitting long periods of time. This goes also for traveling in cars and moving around like that. I'm going to show you another case, and this case is a male in his 40s, and this is his lateral lumbar view, okay, and this is his pelvis. It's not quite as clear as the other, but I think you can probably see what we're looking at here. Come on over here, sir, if you'll just sit right there, and I'll be right with you, okay? This gentleman, this young man, has got some low back pain, and what I'm going to be doing is I'm going to work on that low back pain. Now his lumbar vertebra is not much as curved as the young lady's, but it's still got some curvature in there which can be corrected. He's also got a few little hints of arthritis in the spine. This is called osteoarthritis or weight-bearing arthritis, which is not bad. It's to be expected as you get older. You're going to have some of that in your spine. Now his pelvis is very wide, So that means that the pelvis itself is flared out on both sides. So I can tell from the way the width of the pelvis, I can tell how far wide it spreads. But also you'll notice that the ischioforamen and the pelvic floor is not quite as big, and the ischioforamen are not quite as flat. So his pelvis is not tilted nearly as much, maybe a little bit like that. Okay, so his may be tilted 10, 12 degrees, whereas the other one was tilted maybe 18 to 22 degrees. Okay, so I'm going to work on his low back, and I'll show you how, as a chiropractor, I adjust a tilted pelvis to take pressure off the sacrum and the low back. If you could take your glasses off and just lie on your stomach. Okay. And I'm going to head. Okay, Dr. Michael Craig here again. I have the patient, a male in his mid-40s, and I'm going to be adjusting his pelvis primarily. So I just want you to know, or want you to witness or see how a chiropractor adjusts the pelvis. And it's very simple. We use what is called a drop table, and I just cock it like that, and I have him move down just a little bit right there, okay? And right over the table does most of the work. And as a chiropractor, once you start getting to be an older chiropractor, you don't have as much strength as you used to. So what happens is the table can do most of the work. So I'm going to be focusing on adjusting his pelvis, and again, his pelvis is rotated forward just a little bit. I'm going to be bringing it back this way. So what I do is I find the ischiotuberosities, which are right there, and I just set up to adjust those. And I just simply do a thrust like that. The table drops. It allows for momentum to be carried forward, and the pelvis shifts just a little bit. And so I usually do this 4 or 5 times. And so I'll be doing that, and then maybe another 3 times. And a few more times here, and one more time. Okay, now, with that done, I can say that I've shifted the pelvis somewhat. However, sometimes I usually do something else. I take it one step further, and I can also adjust the sacrum. The sacrum is right here, and so I can also put a little bit of motion into the sacrum. And the way I do that is I lean forward, so I'm going to be pushing the sacrum down and in like that. Okay? And so I do that a few times. So sometimes I do it 3 or 4 times that way. So this is how I adjust the pelvis using the drop table. Now there's another way that a chiropractor adjusts people, or the low back and the pelvis, and that would have to do with something called a side posture. Side posture is when I have him turn on his side, which I'll have you do right now. Nagaraj, you could turn face this way and just lie on your side here. Yeah. And I bring his arms up like that, and then I have his legs straight like that. This is a very twisted form of, of care, but there's no concern because I don't break any bones. I haven't broken any bones in my entire 40 years of practice, so there's no bones being broken. You may hear some little cracking sound. That's called crepitus. That's just because the joints are moving and there's some air pocket in there or something that you hear. So what I'll be doing here is I'll be adjusting the pelvis, and because his sacrum is shifted forward, I'm going to be, again, sort of bringing that back. Just have you take it, just relax for me, okay? Relax. And I just set it up. This is a twisting move. Okay, relax. Okay, good. So a little bit there. And so usually I have the person turn on the other side, turn over, and then I do it from both sides. Because I'm dealing with both sides of the pelvis, I like to get the pelvis from both angles. Again, this is not necessary, but I use it because I want to make sure that the segment or the pelvis goes back to where it needs to be. So just relax. Okay, good. Okay, thank you, sir. Go ahead, sit up. Good, just stay there. Good. So that's a chiropractic adjustment. Now I usually go on to adjust other things, the mid-back, and then I go to the upper back, and then I work on the neck. So if you're having neck pain, headaches, problems in the mid-back, these are all chiropractic problems, especially if you have neck pain with pain down the arms and shoulders. I've got another video that talks about that. That's all for today. Thank you for joining me. I hope this has been helpful, and I invite you to come to Whitefield to visit me, and let's get started. Thank you.